you for opting in for this video, the top 5 stretches for fibromyalgia and chronic pain. And if you're here today, most likely you've been diagnosed with fibromyalgia or chronic pain. And depending on how long you've actually been diagnosed, you may be frustrated or be in increased pain, have a lack of mobility. You may not even be able to get in and out of bed without excruciating pain, and your search for answers could have been very long and tedious. In this video, you're going to receive the top 5 exercises to help you stretch so that you can get some pain relief today. Now, you can perform these exercises in the comfort of your own home. And before you start, I want to give you a little bit of information about who I am and how I came about working with clients with fibromyalgia. Now, my name is Kim, and I'm the owner and founder of Stretch Physical Therapy and Total Wellness in Westchester, Ohio. And I've been working with patients that have been diagnosed with fibromyalgia and chronic pain for over 16 years. And in that time, I have found that the system that we have currently with our health care really is not very efficient in finding answers and answering the why and how of going from when you have a flare-up and an excruciating pain that is debilitating to where you can get rid of that pain and it not be a constant cycle of pain to where you can't function daily. And with my program, I've put it together that it's pretty comprehensive. And in comprehensive, I mean we teach trigger point release, we teach myofascial release, we also do and perform manual therapy techniques that help decrease your pain. We start you on the road to recovery by adding stretching exercises that are very gentle. We start you on an exercise program that is pretty basic. And then we also incorporate relaxation techniques and we answer the why, how, and help you to understand what's going on so that you can progress out of that cycle of pain to where you have constant flare-ups and you can get out of pain and find some relief. This hits me personally, unlike other therapists. I've worked with many people and helped them decrease their pain over time, but this has hit me personally in the last 3 months, and I want to introduce my daughter Megan to you and let her tell you a little bit about her story with fibromyalgia.
Hi, I'm Megan. I'm 23 years old. I was diagnosed with fibromyalgia 5 years ago after a pretty significant car accident. I went to tons and tons of doctors, from rheumatologists to immunologists, different specialists. I went to neurologists for headaches. I went to oral surgeons for TMJ, nutritionists, and even a bunch of different physical therapists, even though my mom's a PTA. And for about 4 years, while I was an undergrad, I was on multiple different medications, from antidepressants to muscle relaxers and painkillers. I tried supplements and changing my diet and everything like that, and I just haven't exactly found relief. None of it really significantly helped any of the pain. I was still on about a 7 or 8 pain level out of 10 on a daily basis. And I still have good days and bad days, but through all of the physical therapists that I went to, I never really found anybody that catered to the fibromyalgia the way that my mom and the PTs here at Stretch really do. I'm not just saying that because she's my mom, but mainly just because they treat all of their patients like they're treating their own children or their own family members. So you really get more of a personal one-on-one care. So I still have pain, but it's significantly less than it used to be. And I know that a lot of you watching are probably really frustrated and you're probably exhausted from being in pain every single day. But you don't have to live like that, and there are a lot of people that can help.
Megan is also off of medications now. She was on medications, and now she can officially say she's not taking any medications for pain. So she does have pain, and she does live with some, but she understands the ins and outs of what triggered the pain, what caused it, and how she can prevent a flare-up, and what she needs to do when she has a flare-up. And that's the most important part about seeking treatment and care, is figuring out what you can do within the parameters of where you're at right now. So let's get started. Let's teach you these 5 exercises to help you get some pain relief today. But do know, these are general exercises. Every exercise does not fit each individual person, and exercise alone is not going to cure your fibromyalgia. You're going to have pain and flare-ups and days that you cannot do any exercises at all, and that's understandable. So know when you do these stretches, I want you to only hold them for a count of 3 seconds each, and I want to make sure that you're fully relaxed when you're performing these. So you're going to start off on a flat surface or a bed, and you want to start by laying on your back. And when you have pain, I just want you to go up to the point of tension, hold it for a count of 3 seconds, and then you're going to relax it. And we're going to go through these together so that you can understand this. So Megan, I want you, for your first exercise, to bring one knee up and pull it and hug it into your chest. And if this is too uncomfortable, you can bring the other leg up, and you just want to bring it in as close as you can. Hold it for a count of 3. 1, 1,000, 2, 1,000, 3, 1,000, and you want to let it go. You know, it's very important here that you let go of it and you don't count past 3 because you don't want to cause yourself to go into a little bit of a flare. Chances are after you do these, there's a big chance you will have a flare-up tomorrow or tonight. Each person is a little bit different. Take it in stride and do the stretches again, but again, the second time you do them, only count to 3 seconds for each exercise. Now let's do that 2 more times. Now this time, Megan, I just want you to do one leg. So you're going to bring one leg up, squeeze it into your chest. If this hurts your knee, then you can put your hands behind your leg, squeeze it in, relax, let the tension just release, and then drop the leg back down. Now you're going to do 3 of each of these on each leg. Let's go ahead and do one more on this leg. 1, 1,000, 2, 1,000, 3, 1,000, and down. Okay, so we've got 2 more. One more on this one. 1, 2, 3. Okay, we've got 1 more time. And 1 more on the other leg for me. Okay, the next stretch you're going to do, you're going to bring both of your feet up till they're flat and both of your knees are bent. Now, gently, I want you to take one knee out to the side, and I don't want you to let your pelvis rock when you're doing this. You're going to feel a stretch on your inner thigh. Hold it for a count of 1, 2, 3, and bring it back up. Now, if this is not too sore for you, you can open both legs up, but again, I want more gentle techniques to be used in the beginning so that you don't cause a flare-up. So if you feel comfortable, Megan, again, we're not pushing through this. I want you to open it up. 1, 1,000, 2, 1,000, 3, 1,000. Bring it back together. One more time. 1, 1,000, 2, 1,000, 3, 1,000. Very good. Now we're ready for your third exercise. This one, keep your knee bent. Take this leg and point the foot up towards the ceiling. You want to keep your hip at a 90-degree angle, and you want to press your heel up, 2, 3, and then just bend your knee here. Now, if that's very easy, then you can put this leg down. Now take it up. 1, 1,000, 2, 1,000, 3, 1,000, and relax. Again, very easy and gentle. Do it one more time on this side. 2, 3, good. And then straighten this leg out, and let's do 3 on the other side. 1, 1,000, 2, 1,000, 3, 1,000, and 2 more times. 1, 1,000, 2, 1,000, 3, 1,000. One more time. Good. Very good. Okay, we only have 2 more here. I want you to take this leg straight out. Take this leg and cross your knee. Nope, we're going to go this way. We're going to kind of cross over this way. This arm is going to go out this way. You're going to turn your head the same direction as your knee. You're going to feel a stretch throughout the upper torso, sometimes in here. Hold it for 3, and then bring it back to just relaxing it just a little bit. do 2 more of those on that side. 1 1,000, 2 1,000, 3 1,000, and then one last time. 1 1,000, 2 1,000, 3 1,000, and you want to repeat it on the other side. Bend this knee up, cross it over, hand here. There you go. Put that arm all the way up for me. Turn towards this shoulder and knee. 2, 3, and relax. And 2 more times. 1 1,000, 2 1,000, 3 1,000. One more. 1 1,000, 2 1,000, and 3 1,000. All right. Now the next one are for those of you who suffer from headaches and upper neck pain. So Megan, I want you to sit on the edge of the bed right here for me. And actually I'm going to have you bring a stool out from under there to put your feet on. You need a surface that is the crate that's under there that's just about the size of a crate here, okay? And what you're going to do with this is you're going to put both of your feet on it. You want your knees to be a little bit higher than your actual hips are. And now what you want to do is lean your entire body over your knees. Put your hands down. Put your hands down around. And then I want you to drop your neck down so that you feel a stretch in your neck, and typically up into this upper thoracic area is where you want to feel it. And then I want you to hold that for a count of 3 and come back up. Good. And 2 more times there. Make sure you drop that head down and you feel a pull. Good. And one last time for this last exercise. Very good. Okay, so those are the 5 exercises I would choose for you to start with, and you can do these within the confines of your home. Now, for those of you who have more questions and would like some more one-on-one care, please give us a call at 513-874-8800, and we'll offer you a free wellness consult. And that'll take about 30 minutes. We'll talk about where you are and actually give you a solution to where you are to get you out of your constant pain. Now, if you're not ready for that, we totally understand. If you want some exercises that you can do, feel free to give us a call and ask us for some myofascial stretches, and we'd be glad to mail those out to you. But if you are ready, again, give us a call at 513-874-8800. We'd love to help you get us started towards your journey of pain-free living. Thanks again, and have a great day.